everyone for another riveting podcast from the middle road. This is Nishant Malhotra, and today I'll talk with Mr. Ronald Abraham, who leads IDinsight India office and is also the co-founder of the venture. We'll have a deep dive conversation on the social and development sector with a focus on impact evaluation, recent social innovation within this space, various data analysis tools and methodologies, including machine learning, impact bonds. We'll touch a bit about development impact bonds and random control trial, among others. The objective of the podcast is not only to understand the innovation enabling social change and impact within the development sector, but also understand from Ronald the nuances of makings of a successful career and transition within the data-driven development ecosystem. The conversation will update the audience on the best sustainable development practices driving all actors within the international development sector. Hello, Ronald. A very warm welcome to the Mill Road platform for an insightful podcast on the social and development sector.
Thank you so much, Nishant, for having me. I really look forward to our conversation.
IDinsight is a global advisory data analytics and research organization that uses data and evidence to help leaders maximize their social impact. It works on a collaborative principle. Its collaborations deploy a large analytical toolkit, including machine learning and randomized evaluations to help clients design better policies, rigorously test what works, and use evidence to effectively at scale. Now, there are multiple set of actors involved within the social and business sector. IDinsight works in all the major sectors, significantly health, education, agriculture, governance, digital ID, financial access, and sanitation. And they have offices in Dakar, Lusaka, Manila, Nairobi, New Delhi, and San Francisco. So pretty spread out both in the developing world and the developed world. Ronald has several, you have supported Aspirational Districts Programme, the State of Aadhar Initiative, learning partnerships with governments of Bihar and Andhra Pradesh, and education projects which stir Akanksha and going to school. Now, Bachelor's of Honours degree from St. Stephen's College, Delhi University, and a Master of Public Administration in International Development from Harvard Kennedy School. Now, we've done a lot of great work, specifically also you were one of the impact evaluators, which we'll talk about in Educate Girls, which is one of the first development impact bond in the world and which was completed in India. So, Ronald, a very warm welcome and thanks for, coming and giving us a deep dive on understanding policy interventions and innovations within the data science.
Thank you once again, and thank you for the kind introduction.
Let's start with more of a global question. You worked extensively in the social sector in India. At Pratham, early on in your career, you worked both as a researcher and as a manager of a widely successful education project in the state of Punjab in India. Now you synergized your work as a national in the national coordination team for annual status of education report for policy analysis and as an implementer of learning excellence program called Paro Punjab, which covered 13,000 schools, and you had a deep impact. About 1.3 million children in the state of Punjab. It impacted about 1.3 million people, children. So that's actually a huge number. The program was further designed to increase the knowledge level of students of children from class 1 to class 5. Fifth. So this is the range which the project actually was implemented in. So when you're talking about how did this experience, along with your master's degree in public administration from Kennedy School of Government, Harvard University, propel you towards opening up one of the world-class research organization? So could you take us through what were the enablers? How did it come about with this experience and the education? How did it lead to?
Yeah, definitely. Of course, at the heart of a lot of this is just a lot of serendipity. And it's not the case that, one thing very clearly led to another and there was this very planned out mode of action that you're seeing. And so, when I think through, I always been interested in using my skills in a way that is helpful for the larger society. And that kind of prompted my career choices from the very beginning. And a big part of my initial career was spent at Pratham, both in terms of supporting the annual status of education report, and also after working on that report for 2006 and 7, working in a more programmatic mode within the state of Punjab. So working very closely on more kind of nuts and bolts implementation work as well. And I think I owe almost kind of everything of my career after that to my experience at Pratham. It was an extremely foundational experience where I was able to travel across India, meet lots of innovators, entrepreneurial folks within Pratham, outside, within government as well, and travel to various villages, meet people from all walks of society. The kind of exposure that I got, whether it was kind of in Pasighat in Arunachal or in Ladakh or in Kishanganj in Bihar, it's just mind-blowing. And I think that that kind of exposure is really what propelled me and kind of solidified my interest and inclination to spend my career in this space, more broadly defined. And then specifically, I think the two pieces of work that I did at Pratham was very, very illuminating for me. So my start at Pratham was in the annual status of education report, and as many of your listeners would know, this was the first of its kind learning outcomes survey in India and probably the world, where we were able to provide a clear, simple view of what was the status of literacy and numeracy in every single district of the country every year. And it completely transformed the discussion, which was so focused on inputs, and enabled us to focus a lot more on outcomes. And so what we were seeing was that in terms of schools and having access to schools, India was doing really well. Whereas when it came to actually children who were going to those schools, whether they were actually learning, we were finding that India was not doing so well. And various states, while some were doing better than others, on average, there was a lot of improvement that we needed to see. And I think it was the first time that there was a very clear empirical understanding of this broad-based fact that we were able to bring about with the annual status of education report. So, my role there was really kind of trying to coordinate the surveys in some of the states, and then doing trainings and supporting the development of the questionnaire, the tool, kind of all the nuts and bolts work. I was part of a team that was doing that, and I was one of the members. That gave me a very strong introduction into the role of data and evidence and the role of research and analysis in changing policy, in setting the agenda, in improving the implementation of programs. I was able to take that and take that kind of view and work in the state of Punjab, where we were actually launching a learning excellence program closely with the government. And I was co-leading that with two other colleagues of mine, Vivek and Bharat, and we were essentially in Punjab going from a very small scale to a very large scale. So there was just lots of implementation and scale-oriented work. It was dramatically different from the work I was doing at Asar, which was a lot more research-oriented. And I really loved that experience and learned a lot from it. And I have to admit, made a lot of mistakes, I'm sure, during that experience. And it's the combination of the two that I think gave me an appreciation for the work that I do now. When one is on the research side of things, it is easier to assume that implementing programs are straightforward. And it's only when one has strong direct experience in implementing programs does it really dawn upon you about how difficult it is to organize a large group to achieve a result. There's a lot that goes into that, and I think appreciation for that really comes when one, is in the midst of all of it. And so today, when I'm working at IDinsight, we're really at the intersection of using research and evidence and tailoring that research and evidence to the needs of implementers, practitioners. And so the fact that within a short span of 3 years of me being in Pratham, I got such a deep experience into both, have really, really shaped what I do now and have been very, very useful and serendipitous for the work that I do now at IDinsight. It wasn't planned, but it seems almost kind of, elegantly wonderful that it worked out that way.
No, that's beautifully put, elegantly worked out. You talked about, moving everywhere, very pristine places, I would say, working in small towns, beautiful places, and doing a lot of development work. Now, I'm really appreciative that you said you made a lot of mistakes, and that's the greatest learning experience because that's where you learn. I made so many mistakes in life, and I think I keep making, and that's really nice in the sense that's a part of parcel of work. So, yeah. So now that gets me thinking is like, what were the challenges? Of course, there are, I could, like you rightly mentioned, and implementation is by far maybe even much more challenging as compared to the work and research. So what were the challenges when, would you encounter when you came up, you worked with across diverse set of actors within the social sector? That was one. And then when you're coming up as an entrepreneur, that itself is a huge challenge.
Right. So when you mean challenges while I was at Pratham or at IDinsight or more broadly?
More broadly, when you're there at Pratham, what were the challenges when you're meeting different set of actors within the social sector, and then you wore the next hat and you became an entrepreneur. And then what were those challenges? How do you relate those two challenges together?
Right.
Were there any synergies between them, which you could say, okay, these are challenges which I think I anticipated. I got a good view, and I already have a fail-safe program to overcome that.
Sure. So essentially, to create deep impact when working with governments, firstly, working with governments is a strong opportunity to create deep impact because the scale at which governments work means that even if you're able to improve that work by 1%, 5%, the absolute level of change that one is able to contribute to is immense. And so I think that has always been a deep motivator for me. And of course, for, the converse is also true, which is that, one can't have super deep, huge impact when working with government. It's really about kind of raising the ocean by 1 millimeter rather than raising the well by 2 meters. Kind of thinking that one needs to have when working with government. But then the main challenge that will always remain when working with government is the fact that collaborations are vital for making impact, and collaborations require bringing lots of different stakeholders to one, aligning the goals of lots of different stakeholders. And this isn't something that is unique to any kind of program or organization. I think this is just something that one needs to, they are doing really well, and is kind of the foundation for being able to create good, deep impact with working with governments. Because without this kind of collaborative approach where different stakeholders are coming together on a common platform towards common goals, it's going to be difficult to achieve that kind of impact. So I think that I would say is a bit of a central theme through all our work is fostering those partnerships.
And partnerships you would feel like one of the most important ingredients of what you do, right? That because a lot of things are moving in public-private partnerships nowadays in the development sector.
Yes, I think so. I think they're vital for creating real change.
You're doing a lot of groundbreaking work. Now, when you're doing that, of course, theory of change is become embedded within the sustainable sector. Now, when you're designing a program evaluation, you would include this philosophy within your implementation process. Now, that's something so much ingrained within the development sector. Would you like to share the pathways to change process with an example from your work? Something where you could really say, okay, this theory of change is how I use the outcome-based approach when building up. And one of the things, in any of the projects which you directly or indirectly might have encountered.
Yeah, and I think just to kind of building theories of change and using that as a foundation for our work is really central to a lot of the projects that we do, and asked about this. But to just ensure that everyone's on the same page, essentially what a theory of change is that it's an organizing framework for every organization for how do they believe they are going from their resources, their activities, and the work that they're doing to creating real results. And then how do those results actually lead to meaningful change in the lives of individuals, or other kinds of outcomes that one is desiring. And this framework what is usually organized in a slightly linear way to keep it fairly straightforward and simple for everyone to understand. But of course, everyone understands that programs are usually much more complex, but it's useful to have a model to just ensure that we're organizing our thinking. Now, what is fascinating is that, while broadly everyone understands this way of approaching a project, it isn't the case that everyone is actually using the simple tool when they think about their programs. And what we find quite fascinating, Nishant, is that when in some of our projects we actually do workshops on theories of change with our partners, it's such an illuminating conversation for the partner organization staff. So here is an organization that's working on a project, that's designed this project together, program together, and they, in that workshop, when we actually kind of try to put this framework in front of them and have them work through what are the resources we're committing, what are the inputs that we're committing, what activities are we doing, and then they have to articulate what results are we achieving, and then they have to articulate why are these results important, how is it changing people's lives. You realize that actually, if there are 10 people in the room, there are 10 versions of theories of change in their heads. And it is the process of putting that on paper or on a whiteboard that actually becomes very, very clarifying. And so what our job really has been is really to just be a facilitator for that conversation that is mostly happening within the organization and amongst the organization staff, helping kind of like organize the conversation and facilitate it. And what we understood over the years is that this framework is really a powerful tool to ensure that everyone is working with the same assumptions of the program, is working with the same understanding of what the program is trying to achieve. And just that fact makes our future efforts much more aligned. Now, specifically with the theory of change, like what can one get? So I think like one of the big things that we are able to understand using this framework is which parts of our program design are we sure of and which parts are we less sure of. For example, it might be the case that we are fairly sure that providing, let's say, midday meals in a school program is useful in increasing attendance of children, at least up till the meal is served. There's a lot of it. Let's assume, when one goes through this process, there's a lot of evidence within the organization and from research outside the organization that points to that. Now the next question is, okay, but then it increases attendance, but does it increase the nutritional level of the children? Does it increase the attentiveness of the children? Does it increase the learning outcomes of the children? Now, people within the organization will say that these 2 or 3 things are what we're trying to achieve. But what it helps us understand when we put it all very clearly on a whiteboard is that here are certain links in this theory of change that we're sure of, and here are other links that we're less sure of. And I think just understanding where the certainty and uncertainty is really clarifies where more data and evidence will be helpful to understand how the program needs to be bolstered. So this for us has been the kind of most important leverage point with this tool. It really organizes everyone's thinking really well in terms of where can data and evidence be an impactful tool for the organization that we're working with, and brings everyone on the same page. Naturally, there are other tools that also need to be deployed to improve the effectiveness of the organization. Because we are a data and evidence organization, we are thinking through more clearly on, like, is there a use for the tools we have access to for this organization? And this workshop or this theory of change framework is what enables us to get a better understanding of that.
Interesting point you made. You talked about a midday meal and how it could be linked to the learning outcomes. Now, this is a very interesting case where maybe you'll take evidence before the project was implemented, and then you'll try to see what exactly how did it impact the learning outcomes. Am I correct here? That's what you could in one way make a matrix and look at how the evidence based in terms of in learnings, how the midday meal could have.
Exactly. Depending on if that is the program we're trying to evaluate. I mean, this is a hypothetical example that I gave, but assuming that was the program we're trying to evaluate, people within the leaders of the program might suggest that, okay, these meals are useful in improving attendance. We have a lot of evidence about that. We believe that these meals are also useful in increasing nutrition, attention, and learning, but we're not sure. I think just having the framework actually enables us to understand very clearly what we are sure of and what we're not sure of. Because without the framework, I think that articulation is not always as clear. But when you put everything out there, it just helps organize our thinking.
Yeah, it gives you sort of faith base. Yeah, that therefore they would be doing much better, but how much, right? So that's a very good point which you made. Now, coming back to, let's go into the topic of pandemic, and I'll come back to evidence base because that's the next two questions would be on. We've seen a huge incremental evidence coming in within the sustainable sector. During the time of the pandemic, you have you're doing fantastic work. You're working on something known as Pandemic Response Initiative. It's a multifaceted collaborative partnership with the Global Health Group at University of California, San Francisco, and Evidence Action. Now, we will be soon launching a data analysis tool under the Pandemic Response Initiative. Now, how will this tool catalyze a more informative response, I could say, to COVID-19? And how do you think it's going to be freely available in India or globally? How do you see that? Could you sort of share a bit insight on what you're doing here?
Yeah, definitely. I mean, essentially, as COVID-19 hit, one thing that just generally we saw at IDinsight was that our partners who we have deep trustful relationships with turned to us for support in various different ways. In the Philippines, the Ministry of Health, Department of Health turned to us in terms of getting support on various kinds of scientific advisories that they wanted to issue to the general public, just ensuring that everything that they were issuing was backed by clear evidence. In Delhi, the government of Delhi reached out to us to support them on building the data patient management system and the various kinds of analytics that decision support analytics that they need access to, all the way up to the chief minister's level, and so on and so forth across the places we work with. And I think this was a good experience and testament to us about the broad model of IDinsight, which is one, using very rigorous data and evidence for informing social policy, but two, tailoring these data and evidence tools to directly help the decision makers and the practitioners, the doers of our society. And in so doing, having this kind of approach, those doers, when they were faced with such an unforeseen crisis, they turned to people they trust, and we were very, very fortunate to be able to help in whatever little way we could to some of our partners who reached out to us. This initiative that you just mentioned, Pandemic Response Initiative, is a part and parcel of that sort of global effort of lots of things that we are doing. Specifically with PRI, what we're trying to do is really support lower and middle income countries in helping prioritize how to deploy testing tools, testing kits in a resource constrained environment. So, as we already know, testing is one of the most important levers for trying to limit the spread of this virus. And that being said, the availability of testing tools is quite constrained, and especially so in lower and middle income countries. This availability has dramatically gone up over the last few months, and yet we see that positivity rates, for example, in many countries across the world, is still well above 10 or 15%. While the WHO recommends that it should be at least 5% or below. And so this points to the fact that there is a scarcity in testing resources. And what we are trying to do using this initiative and this tool is actually provide a very clear framework and method to help decision makers in these settings prioritize where they should be using their limited tools. And there are a few kind of broad criteria that we use to help understand this. We are thinking, the tool essentially helps us think through, are the tests going to help in limiting the spread of the disease and managing the epidemic? Are the tests going to be resulting in action? Like, will the results actually change the way we work? And are the tests going to reduce uncertainty around COVID-19, either at the individual level or a population level? So kind of these kind of three overarching criteria principles is what is determining how to prioritize where to test. And so this tool is going to be launched pretty soon and will be in the public domain and will be available for free of use, of course, including to cities and district leads across India as well.
So, as I understand, based on this tool, you can figure out where the testing is required, right? It's much more prominent or much more required as compared to other places. Am I right here in my thinking?
Yeah. And by where, it's not just for geography, but even like which subgroups, which person.
Demographic or which subgroups, right? I mean, which you can sort of look at. And just this is very interesting what you're talking about. Just from your insights, what have you said some of the times the positivity is in more than 10 or 15%. Would you like to share, if you could, what are your insights when you're looking at these subgroups? Which subgroup you think is the most vulnerable among? Is there a sort of a demographic which we have? I know elderly people, specifically with underlying cases, are much more susceptible to. Would you have any views here?
Yeah. So, I mean, I think essentially this, my understanding of this personally is mostly based on the Delhi-based work that we've done. And it is what we're seeing. I mean, firstly, I think in terms of which subgroups are more vulnerable, I think that the data and the research is out there and is not really something that I would say, we are learning from that data and research and are trying to apply it and advise our policymakers, not that our data in of itself is kind of throwing more insights on that relative to what's already out there. I would say, within the Delhi context, over time, what we were seeing was that in general, positivity rates tend to be higher for older people. What that means is that perhaps the level of testing amongst that group is lower than younger groups. And that isn't entirely surprising in that families will make decisions that if someone is if someone is old, they may choose to not take them to the testing center unless they absolutely need to, given the risk of taking an individual to the testing center and potentially contracting COVID-19 at the center itself. Or there could be other mobility or cost related reasons as well. So there are trends like this that we have seen, differential positivity rates, and of course differential fatality rates in the data. And we've used this to sort of help advise the government as well on how they can proceed. We do see is an unfortunately differential positivity rates across labs, and then also other issues with like some labs being better at disclosing the address and phone number of the individuals so that the medical authorities can follow up later, and other labs not being so thorough with that process. These are the kinds of insights that are more operational and granular in nature that we're able to provide to our partners on an ongoing basis.
So did any of these results surprise you just to, or, you said, oh, this is something I really never thought about, but, or some of them might have been like, okay, this is something which I think would have happened.
Yeah, lots of things surprised us, but then over time don't surprise us. I think perhaps like in the beginning, one thing that surprised us was that there was a huge percentage of patients who were not being contacted because of poor contact information available for them. And that was very worrying because naturally only if you can contact them, can you reach them, let them know that they need to be isolating, so on and so forth. Another thing, but that has come down dramatically over time. And I think some of the data that we were able to shed light on this issue, I hope has also contributed to that. I would say something else that was surprising to us was the time it takes to go from, especially in the early stages, to go from trying to get a test. It used to take 1 or 2 days to get a test. It used to take 2 to 4 days to get your results. And then it used to again take some time for you to come to know what your results were. And so that duration in the beginning was very, very long because of the backlog. So that was also limiting the effectiveness of the response. So, when I think back to these things and having seen similar issues crop up pretty much all around the world, literally, I think we were seeing that the contactable rates in New York and London were at the same level or worse than what we were seeing in Delhi. Over time, I feel like none of this is as surprising, but I think when we were in the thick of things a few months ago, learning all this kind of on a day-by-day basis, I think everything seemed surprising and interesting.
Yeah, that's very true. It's been an eye-opener how during the pandemic, how different data keeps on coming out. So this nice you shape this as your personal observation, and that's actually really important because you're at the frontiers of of the pandemic, and you're one of the I would say data scientists in a way. You're analyzing, so your views are of utmost important. Now, we talk about evidence-based approach. Now, if you've seen from 2000, we had about less than 50 reports. Now 2015, we had about 500 reports. So, and we also have the United Nations, which has got 17 Sustainable Development Goals, and it's so important to move towards them by 2030. So please do share, according to your experience, first, how have you seen, since you've been there, about last 2 decades, you've been for the last 15 years in the development sector. Is there been a systemic shift towards evidence-based approach within the development sector, not only in India, but globally? And how would you see India is performing in terms of the global standards?
Yeah, I think a very simple way to look at it is supply and demand. So, as you yourself said, the supply has gone up tremendously. There's been a huge surge in research in the global social sector. There has been a huge surge in the availability of data, both in terms of surveys, but also perhaps more importantly in terms of administrative data and other sources of transactional data, both also from the private sector and from the public sector, that is now increasingly available. So, for example, like one can get access to satellite data much more easily today than even 5 years ago. And so I think from the supply side, there's just been a tremendous rise in various aspects of the data and evidence movement. And it's not just limited to an exponential rise in like studies and research and experiments, or even a rise in organizations like IDinsight. But it's also just kind of a big rise in just the sheer volume of data that's available today than was before. With, of course, the attendant risks around data security and privacy notwithstanding. I would say from a demand point of view, I think we've seen much lesser of a shift in the pace. And I think that should be disconcerting to all of us who are in the suppliers group, so to say. And so what that means is that I think even today, when you think about whether data and evidence is considered an important input into making a decision, what you'll see is that that's probably gone up over the years, but it is still only scratching the surface. A lot of the major policy decisions that still get made today do not actually have data and evidence as a very strong, clear input in making those decisions. There are lots of examples of this. Now,
just to interrupt here so that, for my audience, when we're talking about data evidence, we're talking about the causality in the sense like if X is there and Y, right? We are more on those lines rather than looking at maybe a part of descriptive statistics to just say, okay, how much it has improved. Rather, more on the regression part of.
When I say that, I do mean it much more holistically. It would include everything from descriptive statistics to qualitative research to experimental, careful causal identification as well.
Okay.
And it would include large surveys, it would include administrative data, it would include small n data, everything. I think, especially at IDinsight, I think we really pride ourselves in using the tool for the right question, and we're methodologically very agnostic. And so, definitely, I do have a more broad-based definition when I think about data and evidence. And I think, so to come back to the point I was making, which is that, at the supply side, at the demand side, so I think what is happening is that there is a community, a measurement community, a data and evidence community. Everyone within that community knows each other, supports each other, and is in regular discussions on best practices, innovations, and so on and so forth. There are conferences that happen. There's lots of different brown bag seminars, other ways of interacting that's happening. This is a very well-established, strong community, and that's broadly also aligning more and more by the day in terms of the language that the community uses on describing different terms, because of course common language is probably the most important thing to get a community to work well and effectively together happening. But then there is the decision maker group, which is the largest part of the social sector. These are the people who are running programs, who are in charge of decisions, either at the very small level of a village or all the way up to the level of a whole country, and perhaps in some cases beyond that. And I think that kind of broader, larger implementing, decision-making practitioner community is, there is a very small overlap between these two circles where they work together. And I think both those communities exist to a large part in silos. And of course, our work is to bring all these tools to that large community. But of course, we are a small drop in the ocean of the decisions that get made that we are part of, right? So I think when we look at the trends in the social sector, in the data and evidence piece of the social sector, it's important to understand that while there's a huge surge in the supply, there hasn't been a similar commensurate surge in the demand. And I think there's a lot of need for the evidence community to introspect on what might be explaining this.
Now, you do talk about supply side. So just to maybe for my information also, when you're talking about supply, the actors would be foundation, impact investors, government, even non-profits, right? Am I right in charities? Is that would be the supply part when you're talking?
So for the data and evidence community, when I say supply side, I mean a slightly more restricted group. So it will be research institutions, advisory firms, academic institutions, data analytics firms, consulting organizations. Those will be the broad set of suppliers of data and evidence in some shape or fashion. And governments, of course, is part of it. MOSPI, the Ministry of Statistics and Program Implementation, or the National Statistics Office, are the institutions within the government that are also part of the quote unquote supply side here. Foundations, all of them can be part of the supply side, but the nature of the work, what I meant was suppliers of data and evidence.
So they were more on the supply, demand side, right? That's what, or maybe in as a third party. You're right. I mean, I've now connected what you were saying. So they would be rather, you will be the ones who would be pushing up the analysis. So those are the actors which you mentioned. All right. Am I correct here? Right.
Yeah.
Okay. So now you have built, IDinsight is doing some fantastic work, some mind-boggling work in machine learning, and you're doing a lot of predictive analytical models which you're using in the development sector. I'm also very thankful that you shared an excellent article of Stanford Social Innovation Review, where you in detail explain how your organization uses machine learning to analyze education patterns among the rural sector in India. Specifically, you talked about Educate Girls. That's one of the projects which it's focused on. So based on what you're doing, I would be really interested on key insights like distance to schools from homes in India. Now that becomes a huge part of a significant variable in school attendance, specifically in the rural segment in India when you're talking about. Now that's a huge segment in India. Elaborate on the groundbreaking work which you're doing in this space and the future of machine learning as a tool within the international development sector, because it's more and more become very data centric, and this paucity of data, specifically in developing countries. So your views here would be like,
Yes, I think firstly we shouldn't. I mean, I don't think the work. We would characterize the work as groundbreaking in any stretch. I think the idea here is that there are data and evidence tools out there. We need to be able to understand clearly how to use them to make them practically valuable for the community of implementers, practitioners, decision makers that we support. And it isn't that any one tool. I mean, we should always avoid the trap of like kind of thinking about any sexy in of itself or groundbreaking in of itself. I think like there's been a lot of like harm that has been done when one tries to privilege a tool or a method over the actual questions that matter. So just want to kind of say that as an aside, but to then come to your question a little bit more. So I think the clear part here is that what IDinsight is trying to do when we are working using machine learning is a couple of things. I think there's been a lot of one is at a sector level, and then the other is very clearly at the project level. So at the sector level, I think what we are seeing generally is that there's a little bit of a fad associated with words like AI, machine learning, big data, and
use of that words nowadays.
These words are just kind of used as buzzwords by various individuals without necessarily having a very clear understanding on where they'll be useful and where they won't be useful. And I think it is, given that we are in the midst of like using these tools, I think like at that level, at the level of the social sector, I think we want to just alert people to the value of these tools, but also the limitations of these tools. And then in addition to the value of the tools and the limitations of the tools, also some broad frameworks on how to think about using these tools and whether they'll be even useful for you in your organization. And so some of the work that we do is in that domain, just kind of ensuring that we're not getting again into another fad of methods and instead getting into and instead staying very close to the needs of the population that we're serving. Now, specifically with machine learning, how is it helpful in projects, or in how is it helpful for practitioners, decision makers? I think the main value of the tool is that it's useful for resource allocation, making decisions on where to allocate your scarce resources. And the way it does that is it tries to predict which parts of your target group have a higher need for the services that you are offering. Now, to use the Educate Girls example, Educate Girls is a super innovative nonprofit that's working across India on trying to bring out of school girls into school and then providing the support to ensure that they're learning well once they've joined these schools. And they, their initial model or their kind of main model has been to do campaigns at the village and the mohalla level and actually find out who the out of school girls are in that place, create a roster of those girls, and then work with the local community to actually place them within the nearby schools that they should be going to, sort of working with parents and communities to actually improve the enrollment rates, and then once they're in school, to help provide the support required to ensure that they're also learning, because as we know, just going to school in of itself is not going to translate into learning, and better literacy education, so on and so forth. Now, they are a non-profit with clearly limited resources, and they got a recent grant to scale up their work across India, and I think it was about $100 million that they received. And their initial plan was to, based on their budget calculations, they expected that they were going to be able to reach about 1 million children, 1 million out of school girls, and which is of course extremely cost effective and valuable. But one of their kind of main methods of doing this outreach was to go village to village, door to door. What we were able to do using machine learning was actually help them better understand which villages they should target more closely to get to have a higher kind of hit rate in terms of accessing where there would be more out of school girls. So what our analysis showed was that about 40% of the out of school girls in India, in the regions that Educate Girls is working in, which is across kind of the northern belt of India mostly, about 40% of these out of school girls actually reside in 5% of our villages. And so if you were able to actually identify better which are these 5%, you would have a much higher chance of reaching more out of school girls with the same level of resources. And so what we were predicting is that out of the $100 million that they have received, of which 1 million, they would be able to reach out to 1 million out of school girls. If one is supporting them with machine learning, they can increase that outreach from 1 million girls to 1.6 million girls. So that's a 60% increase in their effectiveness with the same amount of money. And so that is an example of the power of using this tool. Now now the question is, okay, what is it that we're doing? How are we
That was, just to interrupt, Ronald, that's a fantastic example of, which you have taken to highlight the impact, 60% increase on the same amount of money. So then, and that is actually quantifying impact, I would say, right?
Mm-hmm. Yeah. And you have to admit that a lot of work that IDinsight does or organizations like us do, it's not that straightforward to quantify impact. In this particular example, it is. But again, it's valuable to, it's useful to think about the effectiveness of data and evidence more generally speaking in terms of improving the capacity of organizations and the efficiency of organizations to improve their impact with the same level of resources. That's broadly what we're always targeting in general. In this particular case, one can put more clearer numbers to it.
Add on, just to, sorry, you are very right. I should not be, what I was trying to say is that the work which you're doing, some of the impact is humongous. You will not be ever able to put a figure in it, right? But it was really nice that you had a particular figure rate. So you're absolutely right. It's an intangible thing. There is no value to giving education to a young student, a young girl which should change her life. So there is no value to that. I do agree. And but thank you. So please do go ahead.
Yeah, and so I think the last part that I just want to speak to in terms of okay, it looks like machine learning is useful for resource allocation in resource constrained environments, so you get better understanding of which groups or villages or areas to target. So I think if people can understand that's kind of the broad decision that one is enabling through this tool, that'll be a big win just in of itself. Rather than thinking that it can kind of be used for various random things that I think it gets ascribed to sometimes. Then the next question is, okay, then how is it able to do so? And I think broadly, a few things to kind of keep in mind. So one is that there's a lot of rich data out there for your target population if you have the right kind of one or two individuals in your organization, or you have partnerships with organizations like ours to identify those data sets that will have some correlation to the work that you're trying to do. So in the case of Educate Girls, they want to identify data sets that is correlated to finding that is correlated to the outcome of out of school girls. And so what we were able to use publicly available data sets, especially the census. And there was a lot of variables within the census that one can imagine is good at trying to predict whether this particular village will have more or less out of school girls. So that's one kind of main requirement, is kind of this large predictor data set that is available across geographies at a very granular level. The next is that you need to be able to train this data set before you can actually use it for predictions. So you need a separate data set that actually has all the relevant outcome data. May not be for all the villages that you care about, but at least a good solid number. And so in the case of Educate Girls, they actually have been doing household surveys since they started. And so they have a lot of data on, door-to-door data and village-to-village data on whether this particular village has out-of-school girls or not. And so we were able to use their outcomes data to train the census data and other data sets that we use, and be able to then better predict which villages will have out-of-school girls, have a larger chance of having out-of-school girls, even for the villages that they didn't have data for. And I think that combination of having these two data sets with strong analytical support is what is required for us to be able to use machine learning for resource allocation. Note that that's not always, those conditions are not always going to get fulfilled. And which is why it's important to not overemphasize the value of the tool. It's not it's a tool that has a great application when the right conditions are met. And so I think there are kind of three conditions that need to be met. One is you want to have this predictor data, which is at the unit that you want to make your decisions at, and it should be widely available for your whole population that you care about. And so those are typically data sets like the census. And then the second is that you want a more, you want a data set that is clearly got the outcome of interest that you care about, that you can link to this larger predictor data set. And then if the third condition is that you need the right skill sets within your organization or within your partner organization to be able to actually merge these data sets, create the right, develop the right algorithms, refine and iterate and test and improve those, and use that to enable you to get better predictions. And even then, it's an iterative process, because as you get more data, you can improve your algorithms as well. I hope I know it's a little jargony and technical, but I hope I was able to get that across.
Yeah, I mean, you're very elaborate and very comprehensive. So, it was really a very detailed conversation on this. And I think it's shared a very good overview of, how you're using machine learning. And I think you're very correct. One should not overemphasize it. It could just work in the right conditions. And a lot of times it might not work, and maybe you just follow your faith, and, that could be even more required in certain. So it's like tailor-made to each of these products. But when you talk about, it's very interesting. What I gather from your conversation is that you could know those 5% of the villages, and that was so important. We have today of tools and different kind of tools wherein at least you have a fair bit of understanding of what you're doing and how you could approach a problem. So that's really interesting. Now, when we talk about educate girls, it was the, like I talked about, the first development impact bond. And when you, just to give you a bit of a statistics to share here, you impacted about 12,000 students across 332 schools in 282 villages. So that's how the project was done. And half of the village, you in this particular case, you did randomized control trials, which is half the villages were in control group and half in the intervention group. Now I have a small module which I've also made where the audience could refer a bit about RCTs and impact valuation. But do share your experience and methodology in how you conducted the RCTs and how they differ from other statistical inference methods, including descriptive statistics. I've written a brief on this, but if you could take us through, because you're right there as an impact evaluator in this project, so it comes right from you. That's amazing. And just to sort of, before going on that, to give a brief idea, when impact bonds are impact bonds, they are a bit different from social impact bonds. Is that the payer is a third party, which basically is more likely a donor. It's a non-government party, and more likely they have been implemented in developing countries. Although, if I'm correct, social impact bonds have also been implemented in developing countries. So it basically depends on who's the payer. In social impact bonds, it's a government entity, or in a development impact bond, it's a donor, third party, more likely a donor. Or so, am I correct here, Ron?
Yeah, that's right. So that's the large main difference between those two types of bonds. Yes.
So do share about your experience. I thought I'll just make this difference for the audience. And
yeah, and I think so. Essentially, there are various kinds of data and evidence tools that one can use depending on the question that one is trying to answer or the issue that one is trying to support or address. And we had a detailed discussion on machine learning right now. I wouldn't say detailed, but at least a quick overview of the various pieces to keep in mind. And then and another important tool that is used a lot in the data and evidence sector is randomized control trials, RCTs. And I think if I am to just, like the way, one piece is to think through, okay, how is it different from other tools? And then the other is, okay, what is it? So I think just on kind of how is it different, one is to just ensure that we understand that it is, of course, one amongst many tools. And I think the key difference here is that if one is trying to understand very clearly, does X cause Y, RCTs are a valuable tool to use. As many of us have heard this kind of regular phrase, correlation is not causation. And the reason that phrase is repeatedly used is to emphasize the fact that just because we see let's say two indicators kind of going in the same direction, we should not assume that one leads to the other. There could be underlying causes that are leading to both, or it could be completely by chance also. And I think, therefore, what RCTs broadly are trying to help us achieve is that, given that there are lots of reasons for why this kind of why X and Y could be related, we should have a much more specific and clearer understanding on whether it's causal or not, whether it's well identified or not. And I think that is what RCTs are enabling us to do. And for a set of questions, that is really, really valuable. Not for all types of questions, but for a set of questions, that's valuable. And especially the set of questions where the question is of the nature of, I want to try X, but X cost some amount of money, so I'll only do it if it causally improves Y in a particular order of magnitude that I think is valuable. And I think so it is when you have a very clear need to understand the link, the causal links between interventions that you're trying and outcomes that you're trying to achieve, RCTs are valuable. Funders ask for it when they are funding large programs. Researchers ask for it when they want to be able to have a very clear and, I would say, what some would say, undeniable way of saying that X is leading to Y. And sometimes practitioners ask for it when they're trying out various different things, and especially we've heard the phrase. I'm sure your listeners have heard the phrase A/B testing a fair bit, where practitioners are just trying out various different things, and they just need better evidence on whether when they try X is Y changing or not. And now the underlying principle within an RCT is quite straightforward. It's actually like elegantly simple. Conducting one has a lot more sophistication and complexity and nuance, but at least at a high level, understanding it is fairly straightforward. So what we're trying to do usually in RCTs is to really just understand whether, as I said, X is causing Y. And the way to do that is we will randomly assign X to a subgroup of our, let's say, study population. So if you had, let's say, to use an example that we did earlier that we used earlier in this podcast, was around midday meals. So now let's say there's this very clear question that someone wants to answer. Do midday meals increase learning outcomes of children in, let's say, standards 1 to 3 in the district of Madhubani in Bihar, right? And let's say that is your question. Now, what you potentially can do is that one way to answer that question is, okay, let me just give midday meals let me just measure learning outcomes today, give midday meals over the next week, and then let me measure learning outcomes a month from now. Give midday meals over, let's say, next 3 months, and then let me just measure learning outcomes after that. Kind of what is called a pre-post study. And you might find that learning outcomes have increased. And one could then assume that, okay, this means the midday meals led to those learning outcomes to increase. But as we said, correlation is not causation. So why is it why would that be a wrong or a potentially harmful inference? And the reason is that there are lots of factors affecting learning outcomes that have nothing to do with midday meals.
I think just trying to add in, I think in statistics you will say omitted variable bias. Am I correct?
That's right. Yeah, that's exactly right. And so just the fact that over time, the schools are functioning, so children are learning in the schools anyway, you might be finding some learning improvements happening. There may be other interventions that are going on in the district of Madhubani that might be helping improve learning. There may be various external players who are working on improving learning that might also be leading to that. There are just simply various reasons that could be impacting learning. So just because we see a change between pre and post, we don't necessarily need to, we cannot assume that the midday meals are causing that change. And so because this is kind of the nature of the beast, lots of outcomes will have because outcomes can be determined by lots of other reasons. What we're trying to do is have a very precise, careful identification strategy that enables us to isolate what is the clear impact of a particular intervention on the desired outcome. So in this case, that particular intervention in our hypothetical example is midday meals, and the desired outcome is learning. So what we would do in a typical RCT is randomly assign the midday meals across two groups of children that have been where one group will get the midday meals and the other group will not. Now, these two groups are distributed across the district of Madhubani, and statistically, there should be no difference between these two groups. So what that means is that children in the first group will be going to really good schools, but then some of the children in the second group will also be going to really good schools. Some of the children in the first group may come from very underprivileged, underserved communities, but then children in the second group will also be in, there'll be a similar proportion of children in the second group as well that will be in underserved communities. And how do we achieve that kind of similarity is because we are randomly assigning children to those two groups. We are not using any rules saying that, okay, everyone from northern Madhubani will go to group A and everyone from southern Madhubani will go to group B. If you use rules like that, then you might have systematic differences between the two, depending on whether northern or southern Madhubani is, let's say a richer part of the district and so on and so forth. Now, so the randomization is what enables these two groups to be very similar to each other. However, the midday meals now will only be provided to one set of group, one group. And this is what then, if after this, when we compare the two groups, let's say after 3 months of providing midday meals, and we then 3 months or 6 months or 1 year, whatever is the reasonable time frame for us to see that change between midday meals and learning outcomes. Then we compare the two groups, and if after we see that there is a statistically significant difference in learning outcomes between the two groups, we are then much more confidently able to say that the midday meals have likely caused this difference. Because the only thing that was different between the two groups was the fact that one group had the program and the other group didn't. Otherwise, there's no other systematic difference between the two. So that's what we're trying to achieve using an RCT. Again, as we noted in the machine learning example, lots of conditions need to be met before we're able to be fairly sure about the causal link between midday meals and learning outcomes. It is not the case that it is straightforward to meet those conditions. Like if you're the government of Bihar or the district magistrate of Madhubani, she might argue, the DM might argue, there is no way that it is politically feasible for me to actually only give midday meals to half of my district's children and not the other half. Then there are ethical risks in terms of why is it that if midday meals we know is useful for improving attendance and nourishment, why would we deny it to half of the children? There are there is policy inference risk, which is that, okay, let's say the study revealed that midday meals does actually improve learning outcomes. Is it applicable to all of Bihar? When the program gets scaled, will the same features get scaled in a way that the impact will also get scaled, or will the impact dwindle? Or will it be zero in a way that it's not worth it? So can we really infer from this study that happened in one district anything that is much more policy relevant for the full state of Bihar or full North India? There's a lot of kind of risks along the chain that we have to be careful about, and so we should only use this tool, believe that those risks have been adequately addressed, and that's when it makes sense to deploy that tool. We see RCTs being largely deployed by academics, and a lot of times they deploy the tool to uncover theoretical, to uncover very clear relationships that might contribute to a broader knowledge base on that we can use for policy making in general. So, for example, RCTs might be useful in uncovering links between certain kinds of incentive programs and how the take-up of that program changes. And those links might be more universal than just the area that was studied. But again, one needs to carefully think through those aspects of policy inference, aspects of ethical risks, aspects of logistical, political, administrative constraints before recommending this tool to the partners that we work with.
Yeah, true. Ronald, I do agree. I mean, I know it's a very extensive tool. It takes usually a lot of time. Yeah, for example, when you're talking midday meals, I mean, it's just to give for nourishment. A lot of times you need not just even look at or try to relate with some of the evidence, because everybody knows nourishment is so important, specifically for people who are less privileged. So that itself is a huge, boon for the school children. And but this is being rapidly, at least being deployed, and it's good to get to know from you firsthand, how this works out and what are your views. So that's very good. Points. Some of the points which I've made are very critical to understand what is happening in the sustainable sector, what is happening in the development sector. Now, coming back to a global question, and you've been very descriptive, and I really appreciate taking time and explaining specifically from machine learning to RCTs. You've been very descriptive. You have been very detailed, so that the audience can come to know when we are talking about these terms, what do they actually mean and how they are working. So that was really important, and thanks for giving a lot of time on those aspects. Now let's come back to a global question. We had a very detailed chat about your work. Now you're like a role model. You went to Kennedy School, and you're now successfully launched, I would say, IDinsight is one of the best companies in India, at least using data analysis for consulting. This is my view. This is what from my research, which I gather, and I'm sure you are being very modest, and you'll also agree to that aspect. Now, what I really need to know: how did your education and I came to know about from your experience, help you in the short and long run? What are the enablers? For example, you could talk about the network which was there at Harvard School, at the Harvard University. So you could talk to people, what sort of advice you would like to give, or any strategic guidance, also for people who are coming in, who want to come in. There are two sorts of actors whom I feel would come into the development sector. One are young people who are doing their undergrad and postgrad education. One is that. Second are people with extensive experience, maybe in other sectors, but really want to come into development sector. That was me at one point of time before I went to Michigan for doing my master's in public administration. I wanted to move into the development sector. So what would you think of? So this question is in two parts. One is, of course, that you would talk about how did the Harvard network help you, both in the short and long term. What are the enablers? And secondly, advice for these two set of actors which you would like to share.
Right. So I think, the way to think about graduate school, I think the networks aspect, and maybe, I'm potentially blindsided by my biases here.
Yeah, please do go ahead, bro. You would like to know your views. That's very important. Everybody has, my experience is different, your experience is different. And so this is going to give you clarity. A lot of people have their own biases. A lot of people also a lot of times presume things, and this is where you could come and give your experience. Share it.
Yeah, right, of course. And I think in this case, it's just kind of my experience. It's just one data point, really. I think so. Like the networks aspect is, I think, of limited use. And I'll try to get into why. So like, why does one go to grad school? I think, why should one go? I think it is I would say there are three broad reasons to get to upskill oneself, to learn new skills that one thinks is necessary to do their job more effectively or that they enjoy doing. The second is to get a lot more exposure than one would get from the job that they're coming from. Typically, a lot of people go to policy schools in the US after having worked for at least 2, but likely anywhere between 3 to 6 to 7 years on average. And I think grad school is a great opportunity to just get a lot more exposure than the job that you've come from. And the rationale here is that when you work in a particular organization, in a particular sector, in a particular issue area, in a particular type of work, you get a very strong, deeper understanding of that sector. But then you sometimes can miss the forest for the trees. And so grad school just gives you a much broader sweep of exposure. You hear from politicians, you hear from practitioners, you hear from activists, you hear from various kinds of different actors, government personnel, just various kinds of different actors all come at one place and they all talk about similar topics, but from very different viewpoints. And I think that exposure is just mind-blowing. So skills, exposure are kind of two reasons. And I think the third reason I would say is nourishment. And what I mean by that is that it's a great time to just re-energize yourself and enable you to kind of press the restart button for your life, your career. and you've got a lot of experiences till then, and it's still fairly, typically for most people, it's still fairly early on in their career, that it gives you the ability to now like potentially shape your future career with a little bit more structure, where you kind of really use all your learning from your job experience and your grad school to then say, okay, I am good at X and Y, I love A and B. Here are opportunities that bring these things together. I want to do what I love and what I'm good at. And then I want to take that forward. I mean, in my mind, like those are the two things that one should really think about when they make the decisions for shaping their career. And so networks is like valuable to the extent that like it increases your exposure, and for some people it's nourishing. But it really only is instrumentally valuable if you're going to be in a business where you need a lot of networks, or you're in a job that needs a lot of networks. But typically, a lot of us after grad school will apply to jobs. And when you're applying to jobs, you go through the usual process of interviews, CVs, cover letters, interviews. When that happens, like most of the organizations that we would care to join for have a very legitimate process in going through your CV, your cover letter, and your interviews, and making decisions on whether you're the right fit for the organization, and also enabling you to make the decision on whether that organization is the right fit for you. Now, networks don't play a role there. And so given that a lot of the outcomes after grad school is through this process of job applications, I just don't understand why there's such a premium on networks. Whereas where networks do play a role is that, okay, if you're going to be an entrepreneur, you need to like meet a lot of venture capitalists or a lot of like impact investors. Perhaps networks will be valuable. But even there, like the quality of your idea, the persuasiveness of your pitch are going to like trump networks. Like networks will, in all of these places, like networks enable you to get first conversations. And I think it's valuable to have them because you get those first ins. And one shouldn't like discount them, but like one shouldn't overemphasize their value as well, is what I would say. Anyway, that's a little bit of a random aside on networks because you asked about it. But I think like the way to think about grad school for a lot of people is that like evaluate what skills you want to learn, what exposure you would like to have, and whether it's the right time for you to get a recharge, like a battery recharge. If all three things seem to be aligning, then you should consider that.
Just to add on, I did the similar thing. I mean, I wanted to go into development sector, so I thought it'd be a great experience to learn. I always wanted to go to US. I wanted to go to a leading university because the whole you meet, you learn, and try to understand what's the latest thing coming from development sector. So my question more on the global network was when you started your entrepreneurship experience. That was more on that. Now, when you did give your guidance to people, how about people who want to make a shift in between their careers? Let's say they have worked in finance sector, or they have worked in different other sectors in technology, and now because of their passion to give back to the society, which is what drove you to the sustainable development sector, they want to come and into this sector. How they should be looking? They should be looking at very quantitative scales. They should be or more well-rounded. Let's look at qualitative and other aspects which you feel. Do you think are we ready to absorb people with different skill sets within the development sector? That let me reframe it in that particular aspect.
Yeah, no, I mean, I think I go back and forth. It's a very good question. I go back and forth on this. I'm not sure, like if I'm ever settled on this. When I'm talking about the reframed question, are we ready to absorb people into the sector? I think more or less the evidence shows that we are, right? Like a lot of people make the switch from a commercial enterprise to working on social enterprises or to work with governments. And so I think the evidence shows that that is the case, and the converse is less true. So it is not that often that people make the switch from working in social enterprises to a commercial enterprise, or like a non-profit or an international multilateral, and then like go from the UN to, let's say, Nike. Like that doesn't happen, but we do see the switch from the other side a little bit more. Is at least my anecdotal understanding, not that I've seen any numbers on this. Now, so whether we're ready or not, like it is happening. Then the question is, I think, like how to think about how, if you are someone who's making that switch, how should you think about it? I think there are a few different categories of people who make those switches, and it's important to distinguish between them. I think it is not a great reason to make the switch if you believe you're making it purely out of the goodness of your heart, right? And I think this kind of do-gooder rationale of making the switch will really, really wane very quickly. So if that is kind of the big motivator, and that is the only motivator, that might not actually be enough for you to sustain a career shift. And what enables anyone to sustain a career shift is to be able to like deeply love what you do, right? Like, or at least have like a very clear, like, you know, like a sense of enjoyment, fun, where like at least more than half of the work is something you like, if not all of it. So I would say that, like, in addition to this kind of like, I would like to give back to society kind of rationale, one should also have this notion that like, oh, and I love to do this. And whatever that this is, can it be applied to this sector? If so, then I should like make that move. So I've seen people who come from a communications background move to the development sector to be able to work on communications. And there's a strong need for that skill set. I've seen people who come from a data science background switching sectors. See people who come from like journalists making that switch, managers making that switch, people from sales making that switch, people from software making that switch. So everyone is making that switch. And whenever I've seen a successful switch, it is when the combination of I love doing this, A, I am good at doing this, B, and the sector needs this, C, comes together. So one has to identify like that A, B, and C very clearly when they think about making that switch. Your desire alone should not be the decision maker. It should be a combination of what you love doing, what you're good at doing, and whether you've seen very clear asks from the sector for that skill set. So therefore, it isn't the case that, oh, you have to have a quantitative skill set or a well-rounded skill set. Instead, it really should be around like, you know, what is it that you have to offer, and then trying to understand by speaking to different people whether that thing that you want to offer is actually appreciated or valued amongst organizations in the sector. And again, it's useful to not like think of, like, no one, for example, asks the question, what skills do I need to be in the private sector? That's kind of it wouldn't make sense, because it depends on what you want to do. If you want to be in consulting, if you want to be in management, if you want to be in R&D, like, they are dramatically different skill sets. They're all in the private sector. So like, I think the question what skills one needs in the social sector is not the right one. It is like, there are organizations, there are various kinds of jobs there. So it needs to be a little bit more granular than something than like at that level of macro kind of questioning.
So that's very eloquently put. You know, you should be very passionate about what you're doing and where you can apply those skill sets. Now we come to the last question. I know it's been a fantastic, very detailed chat. Now this is always the last question from the middle road is, please do share your aha moment with everybody. You know, whatever moment which brings smile to your lips. It could be from your work experience, from your personal experience, anything which you like to share with the audience.
Yeah, I've really enjoyed this conversation. When you mentioned that you were going to ask this at the end, I was thinking, oh, okay, what am I going to say? So thanks for giving me a heads up that you were going to ask it, so I was able to think a little bit about it. So I want to just share a story from my work at IDinsight that really has stayed with me. So we have this team called the Data on Demand team. And the Data on Demand team's principal objective is to provide high quality primary data or survey data with a reasonable at a reasonable price point, and with much higher speeds than that is traditionally available in the survey ecosystem. And so kind of quality, speed, affordability are kind of all three things that we're trying to simultaneously solve for as part of this team, data on demand team. One of the ways that we do quality management as part of this team is that we do audio audits of the surveys that we do. So what that means is that when a surveyor is out in rural, remote Bihar, say, and they're speaking to an individual, random parts of that survey is recorded by the software that we're using, and of course this is done through full consent of both the person who is being surveyed and the person who is surveying. And we do this so that we can listen in on the conversation and provide feedback to the surveyor, saying that, okay, you're asking this question well, this question you rushed through, you need to be slower, etc. That's why we use it. It's really just a data quality mechanism. But why do I bring all of this up? I bring it up here because it got used in a very different way once, and that really stayed with me. So we were describing the results of our survey on the lack of access to take-home ration in rural communities in a particular state in India that I won't name. And what we were basically saying is that, the administrative data shows that amongst mothers who are entitled to this food ration of rice and of wheat and pulses, of rice and pulses, about 90 or 95% of all the mothers are accessing it. Whereas our survey data was showing that it's more like 65 to 75%, much lower. And so when we were presenting this to the secretary who is in charge of this program, she was pushing back very strongly. It was, she was just like not believing the data. And she was essentially saying, you have a sample, we have a lot more data, you only have a smaller sample. Maybe your surveyor asked in a very biased way. You can ask in any way, and that will really lead the person at the other end to answer the way you want them to answer. So we don't know, maybe your person is biased. So then we were able to actually say, what, ma'am, why don't we just listen to some of these audits, these audio audits. And in one of these audits, you had the surveyor speaking to a woman a mother in a village in the state. And this mother was essentially saying that the local Anganwadi worker is a good person. However, she is never able to give me any of my food. And then the surveyor probed a fair bit, saying, are you sure about that? I'm sure at least you get it sometimes, and all of that. And this enabled the secretary to realize that if anything, the surveyor was actually probing to just ensure that he was not going to record that the food is not being served, and is instead probing clearly to just ensure that what she was saying is right. And then when the surveyor probed, this mother really just poured her heart out. This woman poured her heart out, saying that here are all the issues I'm facing, and we would love for us to get this small ration, and it's not everything. It's only useful for a few days, but it's something that I'm entitled to, but I'm never being able to get it. I won't blame my local Anganwadi worker because it's not her fault. She doesn't get it. And so it's we don't know where the problem is, but all I know is that this is something I'm supposed to get and I would want to get it. It's very important for me and I'm not getting it. And you could see perceptibly that the mood in that room changed. Here is one of the most powerful people in this state. She's probably amongst the top 20 bureaucrats of the state. And here is probably one of the least empowered people in that state. This woman in rural, remote India, one of the poorest parts of the country, pouring her heart out to the surveyor who's probing on, is she sure whether the food has met? And we were able to connect that person, this most disempowered person, to this extremely empowered, powerful person, and just make the voice of that disempowered person really reach that powerful person. And that perceptively changed her viewpoint on the data. It was just hearing that one story really perceptibly changed her visceral understanding of it. Then led to a much more richer discussion about how things can improve, what needs to be done, what she wants us to do in terms of further data collection, and so on and so forth. So I share this story to just, like give an instance where I think it's a useful reminder for all of us who are in the data and evidence space that, numbers are at some level, they just don't tug at heartstrings, and they just don't speak a story as well as an actual individual story does. And we were not expecting this kind of reaction, but we were just trying to just show the audio audit to say that the surveyor is not doing such a bad job. But instead, the audio audit revealed a much higher purpose, which was just connecting these two women from the left and the right of the power spectrum of the state, which, and that has really stayed with me, and has, since then become a reminder for how we should be saying these stories more often than we normally do.
Just curious, you share this example. What did the audio then ultimately change her mind? What happened? What was the end result of after playing the audio?
At least in the meeting, I would say that there was a very major change in the vibe and the way the meeting till then was going in a very the secretary was fairly skeptical and pushing back, but the meeting became far more collaborative and far more collegial after this audio audit. And I think at least there was a perceptible change in the meeting, and then there was a range of follow-ups that she did after that. Now, whether that changed forever and ever, I am doubtful. I'm sure that to some extent, one's biases are difficult to kick out, and so unless you repeatedly have these interactions, it's probably not easy to change someone's mind forever. But I'm hoping that it had some kind of immediate impact then, that had some good follow-ups, and probably left a mark in that person. But whether or not it really did or not, I mean, I don't know. I can say that at least it left a mark in me and my colleagues in the power of bringing stories to bear while we also bring the data, while we also highlight the data. So at least for us, it was an eye-opening moment. Hopefully it was for her too, for the secretary too.
Stories are, of course, very powerful. It's one of the best mediums to a lot of times bring across your point. So, Ronald, thanks a lot. You shared a lot of time. You took out time to speak. I always wanted to do something in the sustainable development sector, a very in-depth podcast. So thanks a lot, being there. And just to also add on, you would also be a guest speaker at the coming up, have a webinar on 29th. So you'd be also, speaking there about innovation, what's been happening in the sustainable sector. So thank you. I really appreciate for giving me time to speak about your work and your life.
Thank you. Thank you so much, Nishant, for this opportunity. It was great being on the middle road with you. Thank you.